SAM syndrome, which is characterized by severe dermatitis, multiple allergies, and metabolic wasting, is a congenital skin disease caused by mutations in the genes encoding either DSG1 or desmoplaskin. These mutations result in reduced epidermal integrity, which may be lethal in children because of recurrent sepsis and extreme undernourishment. The immunopathogenic mechanisms remain uncertain, and no treatments have been available. Available treatments targeting Th17 cells include biologic drugs that are currently licensed for psoriasis therapy, such as ustekinumab and secukinumab. Ustekinumab was recently evaluated with encouraging results in 2 patients with DSP mutations who had obtained little cutaneous improvement in another patient with SAM syndrome who had DSG1 mutations. Because 99% of the Th17 cells in our patient had a memory phenotype, we hypothesized that long survival memory Th17 cells would not be vulnerable to the neutralization of interleukin-23, whereas secukinumab could neutralize the effect of the preformed Th17 pool by blocking the action of interleukin-17A on the skin.
Study today of secukinumab, you showed that this is effective, the first drug shown to be effective in ankylosing spondylitis. Talk a bit about the pathway and how this drug works.
It's the first non-anti-TNF biological to be effective. Of course, TNF blockers are effective, but it's the first non-anti-TNF blocker that is effective. The pathway is well studied in experimental models. We know that IL-23 is the upstream cytokine driving cells to produce IL-17A, and IL-17A is a very potent pro-inflammatory cytokine, certainly in synergy with other cytokines such as TNF or IL-6 or IL-1. We have a number of lines of evidence that this pathway may be very important in this disease. It relies on genetics, where we have different genes that are associated with disease in this pathway, IL-23, IL-17. We have data from experimental models. When we overexpress these cytokines, the animals get spondyloarthritis-like disease. And we have data from patients where we look in the affected tissues that we see that this cytokine is upregulated. So that's the background for targeting this drug in this disease.
And
Shown are photographs of an infant girl with SAM-like syndrome obtained 16 weeks before and 13 weeks after the initiation of therapy with secukinumab. Panel C shows the result of cytometric analysis performed with the use of VISNE, that stands for Visualization of T-distributed stochastic neighbor embedding, which revealed a cluster of T helper 17 cells identified in the infant 35 weeks before the initiation of the therapy.
This is an example of the important steps in psoriasis plaque formation. First, while it's unknown what originates it, dendritic cells in the body are activated. These dendritic cells then release interleukin-12 and interleukin-23. Interleukin-12 then goes on to activate Th1 cells, which in turn release TNF-alpha and interferon gamma. IL-23 goes on to activate Th17 cells. These cells then release interleukin-17A, 17F, and interleukin-22. Together, these released cytokines cause keratinocyte hyperplasia, which leads to the plaque formation that you see here.
Graphs represent the mean counts of Th17 cells per cubic millimeter and the mean frequency of interleukin-17 producing cells in gated CD4 plus T cells in the infant and in controls. Panel F and G show the weight and length of the infant over time as compared with growth curves of the World Health Organization. The blue curve shows the increase in the infant's growth after the initiation of secukinumab therapy.
The Geckerman therapy, which was sort of invented back in 1920, was a combination of tar, which was noted to have good skin effects for skin diseases, particularly psoriasis, and ultraviolet light.
The big advantages to Geckerman treatment are that relief can be derived very quickly. Patients feel better in a short period of time, often within days to a few weeks.
Obviously, Geckerman therapy has been around a long time. We have a lot of experience with it. It's very safe.
So the advantages of topical treatments for psoriasis are that they don't confer the risk of serious infections and cancer that can be associated with biologic drugs. They also have a big advantage in that they work very quickly. So their onset of action is within days, and so patients can get a lot of relief quite quickly.
Typically, the remissions that we get from the Geckerman therapy average about 1 to 2, sometimes up to 3 years on average. I've seen it come back as short a time as 6 months. I've seen it go as long as 10 years. There have been a number of modifications since the original tar and the original ultraviolet light.
In conclusion, the major effect of secukinumab in our patients' quality of life supports interleukin-17A as a new target to treat patients with serious skin disorders, such as SAM syndrome. Furthermore, our study proposes an innovative strategy to identify individualized immune biomarkers to exploit with precision the biologic therapeutic arsenal.